8 minutes later. It is disgusting to watch, but finally, people are paying attention. This is an article that was written 2.5 years ago. I talked about how if you are a nurse who says shit like, I'm colorblind, I don't see color, I treat all my patients equally, that you are part of the problem. You are actively contributing to harm because your passive silence is active violence. So you might not be the nurse that does the side eye to a laboring Black woman, but you won't be the person to speak up when something is wrong. You'll be the nurse just following doctor's orders, just pushing the patient to the car. But if you are the kind of nurse who cannot recognize that a patient's skin color, one of the most obvious things about them, puts them at a 3 times greater risk of death, what are we doing? Greater risk of death? What are we doing? I'm going to explain to you why equality should never be a goal in healthcare. Our goal should be equity. I'm going to use a photo that's often used to explain this, but I'm going to explain why it doesn't work on our scenario and give you a better example. So this is what equity means, okay? We're not giving everyone the exact same thing, because giving everyone the exact same thing will still end with people having bad outcomes. We have to recognize the specific needs of our patient and give them exactly what they need to be successful, or to live, or to not be traumatized when they come into a hospital. Here's why this doesn't work when we're talking about Black women. This puts the problem or the onus within the body of that person.
Now that I have you all here, after subjecting myself to public scrutiny and I have your attention, I want to talk to you about the Black woman that was robbed of her dignity, respect, and compassion by a racist, soon-to-be former nurse. And if you look like me in any capacity, it is your obligation to know and understand what systemic racism is, racial disparities that do exist, such as Black women dying at 3 times the rate of white women and including their babies. It's not enough to just be not racist. You need to be anti-racist. You need to be outspoken. You have the obligation to be outspoken and anti-racist, because it is not a Black person's job to explain their everyday lived experiences to you, in which you will continually reject and deny. It is no longer you didn't know. It is no longer willful ignorance. It is racism. And I don't care if you like it or not. You cannot just treat your patients the same. That is racism. Treating your patients the same means Black people die. They need to not only be cared for, but they need to leave feeling like they were respected and safe. And that's not happening. And people need to keep recording these incidents and posting them online. If that Black mother was robbed of her dignity and respect and compassion, that racist nurse deserves none of it. And when in doubt, shut your mouth and listen to Black women, period.
I cannot believe what I'm reading, and I refuse to let this one go under the rug. So this is a nurse in Virginia. She's 26 years old. Her name is Erin Stratman. Now, she was just charged with malicious wounding and felony child abuse. She was intentionally breaking the bones of Black newborns in the NICU. Now, these babies were already fragile. They're fighting for their lives in intensive care, and the mothers trusted staff to take care of their newborn children. And she betrayed that trust in the most horrific way imaginable. So back in November, doctors discovered that 3 newborns had just unexplainable fractures. And this is not even her first time doing this, because back in 2023, 4 babies in the same NICU had unexplained fractures as well. So that's 7 Black babies with unexplained broken bones in the same NICU. And one baby in particular, this is Noah. Noah was born premature. So then the